Good morning. We'll go ahead and call this meeting to order. At this time, we'll start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. At this time, is there any public comment? Seeing none, can I get a verification of the posting of the agenda, please?
Pam Moore, for the record, the agenda was posted on April 25th between the hours of 3 and 5 at the locations listed on the agenda in accordance with statutes.
Thank you, Pam. At this time, can I get a approval of the agenda as submitted?
I move to approve the agenda as submitted.
Second.
It's been moved and seconded. All those in favor, please say aye.
Aye.
Aye. Motion carries. 6, approval of the minutes of the meeting held on April 4th, 2024.
I'll make a motion to approve the minutes of April 4th. Is that the right one?
Correct.
April 4th, 2024.
Second it.
All those in favor, please say aye.
Aye.
Aye. Motion carries. Our first appointment, 7A, consideration and possible action, application for funding for the Fallon Animal Welfare Group, FOG, in the amount of $3,500. Is there anyone here to speak on this? Come on up, Charlie. Morning. Nope. It'll be the bottom red one. Yep.
There it is. Okay. Good morning, Chairman Ghetto, Commissioners. My name is Charlie Arcenega, and I'm here today representing FOG, the Fallon Animal Welfare Group. On the screen, there are some pictures of our facility, and it's just going to kind of scroll through as we go along. Anyway, we are requesting $3,500 from the county. FOG was established in 2010, is a 501c3 nonprofit established by local citizens concerned about the overpopulation of homeless cats in our area, both in the city and the county. We recently moved into our new facility, which is on the Reno Highway, and it's quite a step up from what we had before. We have set up a lot of individual cages. We have heating and cooling. We have running water, all of which we did not have before. So we take in a lot of cats, both kittens and strays. One of the biggest things that we do is we have a trap, neuter, and return program. We get calls often to be alerted of cats that maybe had kittens. So what we do is we get those cats. A lot of times the feral cats are used to help minimize rodent populations. So what we do with a lot of cats is we have volunteers who trap them. We get them either spayed or neutered, and then we return after vaccinating and shots. We return them to their location, and therefore they can continue with their rodent control while not overpopulating the area with cats. So that's a big thing we do. We have adopted so far out of our facility since December of 2023, we've adopted out 51 cats and kittens to permanent homes, and we have also trapped, spayed, neutered, and returned to their location 97 cats as well. So our goal is to minimize the amount of cat overpopulation, both in the city and the county. We work with the city and their animal control department, and what we're looking for, as I said earlier, is $3,500 to help with our rent, utilities, and so on. If you have any questions, I'd be happy to entertain those.
Thank you, Charlie. And also, I think your whole entire workforce is volunteer, correct?
Yes, we are all volunteer facility. A few of us are here today, and we are in the facility twice a day, morning and late afternoon, to clean the cages, clean the cat boxes, feed the cats or kittens, and just make sure they're comfortable, pet them, get them comfortable with people so that they are good companions when they are adopted.
Okay, any questions or comments from board or staff?
Mr. Chairman, Jim Barbie for the record. Just noting that we have in that line item $3,425 still left, and that's excluding the commission's request of 10% cuts across accounts. Thank you.
Any other questions or comments from board or staff? You want to split it between?
Are you okay?
I mean, 3,500 if we have 3,420.
You want to do the whole three?
Well, yeah, well, 3,500, but at the 10% cut, we're no exception to that. So do it at 3. I was reading in the agenda report that there's nothing else coming up. So, in my opinion, at least, but entertain any motion. Is there any public comment on this? Seeing none, can I get a motion, please?
Can I get a question?
Sure.
This is for Jim. Are we moving this location?
Sorry, say again.
They're already in the old Hendricks Upholstery building. That's their new location. Correct.
Okay, can I get a motion, please?
I move to approve funding the amount of $3,000 to support the Felon Animal Welfare Group.
Second?
It's been moved and seconded. All those in favor, please say aye.
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 Aye, motion carries. Just for clarification there, the county's cutting 10% of our budget this year, and we're no exception to that, so that's why we did the 3,000 versus the 3,500.
We're well aware of the county's budget, and we appreciate the donation, and thank you very much.
Thank you guys for everything you do. Yeah, we'll take a picture real quick. Moving on to appointment B, consideration and possible action and application for a zone change filed by Boulder Opal LLC for property located at 4250 Reno Highway, Fallon, Nevada, assessor's parcel number 008-461-07, consisting of 2.5 acres in the C1 zoning district, whereby the applicant is requesting a zone change from C1 to C2. Dean?
Thank you, Mr. Chair, County Commissioners. Dean Patterson, Public Works and Planning for the record. You have before you a request to change the zoning for Marshall Septic Care. They're at 4250 Reno Highway. If you recall, a few months ago, you had a project changing the zoning for Jared Card out at Leetville Junction to fix some problem zoning. This kind of falls into the same situation. The subject property is currently zoned as general commercial, which is C1. Marshall Septic Care has operated from the property since 2013. At the time, the county code did not have a use table listing for waste collection services, so it was authorized as a construction contractor, which was allowed in C1 at that time. When the county code was updated in 2019, waste collection services were added to the use table and prohibited in the C1 zone, which is intended for retail and light commercial uses. Because Marshall's was established lawfully before the code was changed, it became a non-conforming use and is allowed to continue as it has been. In March, they applied for and received approval for a special use permit to expand their current operations. However, under the county code, non-conforming uses cannot be expanded, so that created a problem. A condition of the SUP's approval was that the expansion may not take place until the business is made conforming by obtaining approval to change the zoning district to one allowing the business. And so this application addresses that condition. This problem comes about due to the historically inconsistent application of zoning districts along the Reno Highway, which has resulted in a mix of C1 and C2 zones sprinkled along the highway. So for example, there's a C2 zone applied to an office complex across from Walmart, and there are C1 zones far from town. This is a situation the master plan goals and policies state needs to be corrected, and this project illustrates the problem similar to the Jared Card rezone that you heard recently. The master plan will be updated this year and will focus on making these into other changes. Staff has undertaken a review of the land uses along the Reno Highway and determined that many areas are inappropriately zoned for the strategy intended for the C1 and C2 zones. The C1 zone is intended for retail activities that are more common to urban areas and better located near the city. The C2 zones allow additional uses and is intended for more heavy commercial activities that tend toward industrial type uses. They're better located far from the city. The review found that this problem begins near the location where Marshall Septic is located. Most uses further west are not focused on standard retail businesses, but rather vehicle, large equipment, and warehouse uses. Based on the review, staff would recommend that the transition between C1 to the east and C2 to the west would be near the Marshall Septic property, and Marshall's Septic property should be zoned C2. The Planning Commission agreed and recommended approval of this request, so I'd be happy to answer any questions.
Thank you, Dean. Any questions from board or staff?
Where is this property at?
Next to Integrity Pest Management, if you recall seeing their sign. So you head out and the road and the highway is along the tracks, and where the highway kinks and goes away from the tracks and the tracks continue straight, it's kind of in that space between the tracks and the highway.
Any other questions? Is there any public comment? Seeing none, can I get a motion, please?
Yeah, I'll make a motion to approve the zoning map amendment to change the zoning on APN 008-46107 from C1 to C2.
Second it.
It's been moved and seconded. All those in favor, please say aye.
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 Aye. Motion carries. Thank you, Dean. Moving on to appointment C, consideration of possible action, an application for the abandonment of a road easement filed by NV Energy for property located north of Interstate 80 in Churchill County, Nevada, APN 004-351-09, APN 004-351-11, and APN 004-351-15, consisting of 640 acres each in the RR zoning district, whereby the applicant is requesting to abandon multiple road easements across the parcels. Randy and/or Dean?
Yeah, Dean Patterson, Public Works and Planning for the record again. Did you want to identify yourself, Randy?
Yeah, Randy Hines, Planning and Public Works Director.
So you have before you an application to abandon multiple road easements. NV Energy is requesting this, and I believe they are here if you have questions for them. So NV Energy is planning a large renewable energy facility, being a solar power project covering multiple square mile properties. The project is located along the I-80 corridor east of Fernley and a couple miles north of the Brady Hot Springs Nightingale interchange on I-80. These lands are in the checkerboard area of the county, so federal lands abut each side of the petitioner's lands. The project will be developed in 2 phases. The first phase will be the north half nearest to the power transmission lines in the northwest area of the county, which will have its special use permit submitted soon. The second phase will be in the south half, located closer to I-80. This abandonment application is for the first half, and the next phase will necessitate additional abandonments. The application proposes to abandon segments of 8 roads running through 3 parcels in the solar project, each of which are 1 square mile in area, and also proposes to replace them with roads around the perimeter of the project parcels. There are many roads crisscrossing the valley in the area. Many are historic RS-2477 public roads that have existed for 60 to 130 years. These are identified on recorded county resolutions resulting from the road project that the county had done some years ago. These resolutions are referenced in the application and also in the motion to approve the abandonments. Since each road needs its own action, this results in a long motion. The main north-south road through the valley is Sage Hen Creek Road. That's on the graphic. That's the pink road running north-south. While it passes through the project, it is not proposed for abandonment. I have had questions about that subject from phone calls and people living in the area. In the Planning Commission staff report is an extensive analysis of the abandoned roads and the replacement roads. Staff had objections to replacement roads that resulted in more difficult driving conditions such as steep roads and hazardous conditions such as moving the road unnecessarily into a flash flood path. In the implementation of an abandonment, NRS states that the abandonment does not become effective until the order of abandonment is recorded. It also allows the jurisdiction to place conditions on approval of an abandonment. When the conditions are met, the order of abandonment would be recorded. So in this case, the abandonment would not be done until the new roads have received new easements and the roads are constructed. The NRS and county code criteria for approving abandonment is that the public will not be materially injured. The Planning Commission staff report used that term in assessing the consequences of abandoning different roads, as well as using references to numbered roads and the different county resolutions. After receiving the staff report, NV Energy staff provided a new overall map, which illustrates the what they would like to do, and that's showing on the graphic on the screen. And these largely address staff concerns and they provided it in an exhibit for the Planning Commission hearing. So the Planning Commission recommended approval with conditions of approval specifically for that layout, and you should have it in the packet. In general, the requested roads in the original proposal were recommended for abandonment, except for some small segments evident on this new map. The main issue during the review was the acceptability of the replacement roads in some of the perimeter areas, and the overall map largely provided the acceptable solution for them. Remaining issues will be resolved by the conditions of approval, especially the one to engineer the roads to acceptable standards. With that, I'll be happy to answer questions, and NV Energy staff maybe have additional information they want to provide.
Any questions or comments from board or staff?
Yeah, I have a question. Are any of these historical roads?
Pretty much all of them. One of them has been there for like 130 years. Others are not that old. And so that's why they're identified in the county's RS-2477 road project and why they need to be abandoned in order to replace them with something else.
Any other questions from board or staff?
Yeah, I'd like to add something. Randy Hines, Church County Public Works and Planning. Prior to the proposed roads being constructed, NV Energy is required to submit civil improvement plans for the new roads and new road easements. And then, like Dean had mentioned, that both of those, they all need to be constructed prior to those being abandoned. So once those are submitted, they'll get those reviewed, accepted, approved, and sent back prior to those being constructed.
Thank you, Randy.
And this is about 20 miles north of Interstate 80?
So it's about 15 miles east of Fernley on I-80, and then about 2 to 5 miles north of the Brady Hot Springs or Nightingale interchange.
Okay.
And so Sage Hen Creek Road starts there and then runs north through the valley, and these are multiple square mile parcels, so obviously it extends from near the highway to far from the highway.
Any other questions or comments?
Indeed, no one's house is going to be blocked off from this, correct? Everybody's going to still have access?
I did have a call from people who are at the far north end of the road, and they were concerned that Sage Hen Creek Road would be blocked or rerouted. I told them that Sage Hen Creek Road would be left alone. They did have concerns that construction was already starting or something. I have not checked on that.
Which one is Sage Hen Creek?
I believe it's that pink one.
Pink one?
Running north-south.
Any other questions or comments? Yep. Any public comment? That was next thing on there. Nope, you're no problem. Just come up and use the microphone, please.
Working. Can you grab the other one?
Hi, Jacob Rudvig, U.S. Silica EP Minerals. We own the mine and processing facility that is directly due south of this, as well as we own a 640-acre parcel that Sage Hen Road directly leads to. That is one of our exploration and resource projects within our pipeline. Our only public comment on this, Sage Hen Creek Road leads directly to our project. If you read through the document specifically, it's talking about needing to maintain access for haul trucks, which is great. But one of the comments was the minimum width for the road was going to be 20 feet, or any of the upgrades to the roads would be at least 20 feet. We just want to make sure that the current width of Sage Hen and any work done at later time by NV Energy is going to maintain the current width so that we can actually get our haul trucks up to that northern project potentially. The other concern is with this, and this may not be the correct meeting or venue per se, but our other concern is one of the major natural gas pipelines runs to the north of this project. Currently, our Fernley facility is ran on fuel oil, and as part of green initiatives, we're looking to upgrade that facility potentially to a natural gas line, working with Southwest, would come directly through this area. So we'd ask there be consideration for a utility easement on that Sage Hen Creek Road if we do need to run through that at some point. So those are our comments.
Thank you. Dean, do you know how wide Sage Hen Creek Road is?
So just for clarification, the 20-foot mention in the packet is for the replacement roads, and so right now they're only 10 feet wide because they're, one lane or even just two tracks. And so those roads will get better. Sage Hen Creek is, I think it varies, but it's probably 20 feet at its narrowest and 30 feet at its widest. But I have not gone out and actually measured it. So we would not be allowing NV Energy to narrow it if that is the concern. And they will probably be improving it to allow better access for the large numbers of delivery trucks, 18-wheelers and whatnot, and then also construction equipment to get up and down Sage Hen Creek Road.
Thank you. Go ahead.
Is 20 feet wide enough for your vehicles now?
So forgive me, I'm an engineer, so 20 feet, and that was our concern. What is the definition of 20 feet? Is that 20 feet road width plus a designed engineered culvert with berm on the side? So general running width, rule of thumb in the industry is about 1.5 times axle width on your roads. At 20 feet, are we saying that that's going to give us a 16-foot running width, which would not allow for 2-lane passage of an over-the-road haul truck and I'm talking just like an 18-wheeler type setup. So rule of thumb, we look for about 24 feet of pure road width. So
What's the road easement up there? What will Sachem Creek continue to be? What's that road easement going to be?
So Sage Hen Creek is one of those old roads, so it doesn't have an official easement now. We'd want NV Energy to establish a normal road easement, which would be 60 feet, but that's the easement. The road width is kind of what it is, and so I think Randy might be better able to talk about the structural part.
Yes, so Sage Hen Creek Road, again, it's not, we're not moving it, we're not doing anything. Any damage that gets, that happens to that road will get fixed and be put back as was, right? There's no improvements to Sage Hen Creek Road. All the improvements will be to the new access roads. So the existing width, if that's suitable for them to access to their property, that's not going to change. So again, there's going to be multiple trucks going up and down this road for construction of the solar field when that happens, if that happens. And like I said, any damage that happens to that road during construction will be replaced in kind.
So it'll be maintained kind of like how Alpine Road is currently. Dean, is that what we're going to do?
It's not county maintained now, it's privately maintained.
Is that how it's going to stay?
We'll be looking more at that during the SUP review, but that would be the normal approach. There was a question about whether the 20 feet was the driving surface or not, and our standard for the 20 feet is for the driving surface.
Does that address your concerns?
yeah, just as long as, like I said, the concern was if they go through there and do maintenance, if they're held to that 20-foot standard, if they were going to narrow down those sections to reduce maintenance costs in the future, essentially.
So is Nevada Energy going to be, please have a seat. Is Nevada Energy going to still provide access to these guys?
My understanding, if Sage Hen Creek Road is going to be remaining open, yeah, we'll be maintaining our access. Okay. It's just our concern is the existing access and the potential utility easements.
Did you have something to add?
Yes, Mark Warden, NV Energy. I lead the development team, so lead the team that's developing this project. Good morning, commissioners and staff. Thank you for your consideration this morning. Just want to clarify, so the road, Sage Hen Creek, is not being abandoned, as was mentioned. All access that currently exists will continue throughout the construction period and throughout, forever, basically, right? I mean, we're not intending to abandon this road in any shape or fashion. It's on BLM land and across our private property, so we can't speak to what's going to happen on BLM land. We don't control that, obviously. But with respect to the portions of the road that cross private property, our intention is actually to make it more passable. Like if you drive out there today, and we were out there doing due diligence, and you have an SUV parked on the side of the road, and one of their trucks comes through, the truck can't even get through, right? So we had to like pull off into the property so they could get past. Our intention is to improve the road insofar as it is on our property. So I don't foresee any issue with their being able to access their facilities via our private parcels, or the portion of the road that's on our private parcels.
Okay.
Thank you. Did you have anything further to add? Is there any other public comment? Go ahead and come up and state your name and address for the record, or no address.
Morning, folks.
So touch the red light and it'll turn green.
Hi, Dean.
I'm Frank LaPera. We have lived out there north of this area for over 20 years, and we use what you're calling Sage Hen Creek Road in and out to get to our place. And well, first of all, I'd like to point out that is not Sage Hen Creek Road. That's been Nightingale Road from the highway clear to Nightingale for 100 years. And when we moved out there, the short section that comes off and goes to Granite Springs Valley was named Sage Hen Creek Road.
We named it.
And the county somehow or another screwed it up on the map. But at any rate, I have no real objection to the, change in the road, as long as our access is not disturbed. And, well, the road is pretty much maintained by the Diatomaceous Earth Mine folks. They grade it probably, I don't know, once a week. So, got anything?
No, that's all I wanted. I just wanted to get the.
So does that pink road that's shown on that map, is that the road that you guys use to access your
That's
property?
Nightingale Road, and that's our only access in and out to town,
No.
to get our mail and all that pink road. And that's Nightingale Road, goes directly to Nightingale. It's been there over 100 years.
Okay, as long as, from the application, from what was said tonight, as long as the pink road is the actual one that you use, there will be no problems with your access to your property?
No, and we were just wondering, I don't understand the map. What roads are they abandoning? We couldn't read it back there. So the green roads,
It'll be the
Are to
green
be
roads,
abandoned.
correct. The green roads will be the one to be abandoned.
Correct.
so that means that whole
Okay.
the whole low road is gonna be abandoned. We
No,
call that the low road.
Two's a low road. That's pink. It comes into it. That's
Okay, so
that's
one
the
is
low
the road that goes alongside, clear up the mountain, clear up towards the mountain, so that would be the road that the ranchers take to go over the hills there. Is that right?
At number 4.
So I can try to clarify what is what on here.
I'm looking at 1. What number 1 is, Dean? What's 1?
Number 1 runs along the west side of the floodplain, the wash.
Yeah.
Nightingale or Sage Hen Creek Road is the pink line
Right.
that is not numbered.
Right.
And then number 2 that someone was mentioning is a little branch that
Yeah,
goes
that's the
south
low road.
for
We call that the low road.
a
That
couple
road-
miles, but then it merges with another road.
Right.
Right.
And so you can see there are roads on both east and west sides of the main floodplain path. And then all of the green segments are small little
To be abandoned.
roads that will be abandoned and will be moved to the sides of the parcels as the blue lines.
The blue lines, okay. Yeah. And just for information, that whole valley there between 1 and between Nightingale, in the wintertime, those roads become pretty impassable, floodplain roads. They become really impassable. You don't take those roads at all in the winter times. So just for you guys to know that.
So that is the crisscross east-west
Yeah,
roads
the
that you
one,
see on the
number 1,
picture.
number 3, and even number 2 there, that little road, they'll
right.
flood pretty bad all winter long, and they're pretty much impassable.
Nevada Energy might need to know that too.
Right, that's what we were.
Okay.
Because they're building right in there, and that whole section there, that 35115, that'll be pretty sloshy all winter long.
Okay.
And that other parcel there, up there will be too.
Okay, does that address your concerns?
I think so.
Okay.
Is there anything else?
No, that's
Yeah,
it for me.
that's all.
Perfect, thank you
We were just
guys.
concerned about our access to and from town.
It'll stay there, you'll be good. Thank you.
Gotta go get groceries.
Now, is it NV Energy that's doing the project? It is. That's good. I'm a retiree from NV Energy.
We both work
so-
in power plants, so we kind of know what's happening here. And we would just like to also be informed as this process goes
And there'll be
along.
more steps to this procedure as it goes
Yeah,
along as
right.
well, so
So
this is
has-
just the very beginning.
Yeah, and so has this project been officially approved?
They'll have to go through an SUP process.
Correct. So they are working on their special use permit application now, and they hope to submit it in the next week or 2.
And that's when you'll get the notification, since your land are run up there, you'll get a notification of how it's gonna look like, the formation of the panels and, all the details on it actually furthermore.
And so the project thing, all 4 of those sections are going to be covered in panels?
Mostly, not entirely, but
Again, there'll
mostly.
be
And,
roadways and stuff in between them as well.
Yeah, I know.
and then further south, some more ones in the second phase.
I've got a question for you, I guess. What power line are you going to be connecting to?
That'll probably be in the purview of NV Energy, and that'll come out when they have their SUP.
Okay.
Well, okay.
Okay,
Thanks.
thank you, guys. Is there any other public comment? Any other comment from board or staff? I do have something for NV Energy, if we could. What kind of infrastructure upgrades are you going to make for Churchill County in the near future? Do you know of any? Is there any plans in the works?
Infrastructure in what regard?
Just serving, I mean, I think rurals are going to face the blunt force of, though this is private ground, I'm sure we'll see some on BLM ground. We're going to face the blunt force of all this. What kind of infrastructure upgrades could the rurals expect to see?
We haven't defined all of that yet. It's in the SUP application, which is being worked on right now by my team and the county staff. So I don't want to speak out of turn because the person that is actually working on it isn't here today. She's she's in the office feverishly working on getting it complete to be able to submit it next week. But I can follow up with an answer to that question.
That'd be great, thank you. Any other public comment? Any comment from board or staff? Can I get a motion, please? Here we go. I can read it if you want. Make it feel quicker.
I move to approve the request from NV Energy to abandon county road easements of the following roads if certain provisions are followed as listed in the conditions of approval in the staff report with an amendment to condition 6 to allow for the reroute as identified in the NV Energy road abandonment presentation for roads 4 and 5. Road number 1 is listed in dock number 47559 located within APN 004-351-09. Road number 1 is listed in dock number 47559 located within APN 004-351-15. Road number 3 is listed in dock number 475562 located within APN 004-351-15. Road number 4 is listed in dock number 475563, located within APN 004-351-09, with the exception of portion noted in NV Energy Road abandonment presentation, page 6, that would not be abandoned. Road number 5 is listed in dock number 475568, located within APN 004-351-09, with the exception of the portion noted in NV Energy Road abandonment presentation, page 6, that would not be abandoned. Road number 6 is listed in dock number 475570, located within APN 004-351-09. Road number 7 is listed in dock number 475571, located within APN 004-351-09, with the exception of the portion noted in NV Energy Road abandonment presentation, page 6, that would not be abandoned. Road number 8 is listed in dock number 475591, located within APN 004-351-11, and to deny the request to abandon Churchill County road easements for the following road. Road number 4 is listed in dock number 475563, located within APN 004-351-15.
My condolences on that one. Can I get a second, please?
Second.
It's been moved and seconded. All those in favor, please say aye.
Aye.
Aye, motion carries. Thank you, guys. Moving on to appointment D, consideration and possible action. Ratification of an amended agreement between Churchill County Social Services and the Nevada State Housing Division for pass-through funding from the U.S. Department of Housing and Urban Development for an increased amount from $21,095.60 to $24,508.79 for the Emergency Solutions Grant Funding for the Homeless Assistance PATH Program. Shannon?
Good morning, Mr. Chair and members of the board. For the record, Shannon Ertz, Churchill County Social Services. First, I want to apologize that I have so many items today, but you'll like my motions, I believe. So we actually were notified by the State Housing Division that they had additional funding that other agencies had not expended. And as part of the HUD agreements, the goal is always to expend 100%. So we were awarded the additional funds to cover costs for our lease that we have for our transitional house. So this is just a ratification for those funds that we will expend through there.
Any questions or comments from board or staff? Any public comment? Can I get a motion, please?
I'll make a motion. I'll make a motion to approve the ratify the amended agreement as presented.
Second it.
It's been moved and seconded. All those in favor, please say aye.
Aye.
Aye, motion carries. Appointment E, consideration possible action ratification of a grant subaward amendment 2 between Churchill County Social Services and the Department of Health and Human Services, Grants Management Unit, CDC Health Disparities in the amount of $46,737 to $88,737 to revise the budget and scope to support the shade structure at the cottage schools and the Churchill County Behavioral Health Intercept Model and the Suicide Prevention Plan. Shannon?
Again, for the record, Shannon Ernst, Churchill County Social Services. So previously, we had the CDC Health Disparities Grant as part of our family resource funding. We had done some projects over at cottage schools. It was coming out of the pandemic and to support further education and activities for youth and families. We were also contacted by DPBH that they had additional funding, and we put in 7 different projects. 2 of those projects were awarded, the one for the cottage schools and the other one for the behavioral health plan, which you previously approved us moving forward with the behavioral health plan, and I told you I'd keep looking for money. We found $17,000 of that. So the only obligation left of that contract will be the $589 that will come from our mental health budget within social services. So today I'm just asking for this ratification. This project does have to be completed by the end of May, because that's when the funding expires.
Any questions or comments? Any public comment? Can I get a motion?
I move to approve and ratify the grant award as presented.
Second.
It's been moved and seconded. All those in favor, please say aye.
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 Aye, motion carries. Appointment F, consideration of possible action, ratification of a property management agreement between Churchill County, Nevada and Century 21 Green Valley Realty for the property located at 280 Quail Way, Fallon, Nevada. Shannon?
And I, again, for the record, Shannon, Churchill County Social Services, and I apologize on this title. This is 280, 282, 290, and 292 Quail. I don't know how we missed that. But as you know, through Home Means Nevada funding that we've received, we did purchase this property. As we're negotiating with the tenants there for their displacement, we did need to have some property management. They'll be collecting rents, making sure that everything is maintained properly through this time. Through the displacement plan, we have provided everyone until October 5th to work with us for their agreements. There's options that they're provided. We assist with moving. We'll provide payment assistance for the new locations, things of that sort. But the property should be 100% vacated by October 5th of this year. Then we will start looking at moving for the rehab of the property for the new transitional house and day center. So we're just asking to ratify this agreement today, if there's any questions.
Any questions or comments? Is there any public comment? Seeing none, can I get a motion?
Make a motion to approve and ratify the
Mike.
agreement as presented. Make a motion to approve and ratify the agreement as presented.
Second it.
All those in favor, please say aye.
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 Aye, motion carries. Appointment G, consideration and possible action, approval of a annual assurance and certification of FTA 5311 and 5339 grants for fiscal year 2025 for Churchill Area Regional Transportation CART. Shannon?
Again, for the record, Shannon Ernst, Churchill County Social Services, and Vice President for the CART Board. And I don't see Councilwoman Kent here on this item. So through the Churchill Area Regional Transportation, they apply for funding that's a 2-year process. It comes to Churchill County, and you sign those. In that first year, you do sign the assurances and the certifications. But on second year, you have to renew those assurances and certifications, and so that's what's before you today. I have worked with the interim director, and is what we will be doing in the future is when these grants come before you, we will be very clear at what the matching looks like, the county's obligations, plus we will obtain approval for the chair to sign the second year when it is time. So we apologize.
Thank you, Shannon. Any questions or comments? Any public comment? Seeing none, can I get a motion?
I move to approve the annual certification and assurance for the second year of the FTA 5311 and 5339 grants for fiscal year 2025.
Second.
It's been moved and seconded. All those in favor, please say aye.
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 Aye, motion carries. Thank you, Shannon. Moving to appointment H, consideration and possible action, first reading of Bill 2024-C, Ordinance 114, and ordinance amending Title VI of the Churchill County Code to authorize the sheriff to release dogs at large to their owners and other matters related thereto. Sheriff and/or Joe. Joe, take it first. And
I will take it. Thank you, Mr. Chair. As part of our code cleanup, the Sheriff's Office had asked for a minor change in relation to the dogs at large ordinance, specifically to allow their deputies, when they come and capture a dog at large, to release that dog to their owner if they know who it is and that owner is present, instead of taking that dog directly to the animal shelter. Sometime officers will capture a dog, know who the owner is, that owner may even be present, but because of the way the code is written, they feel obligated to take the animal to the animal shelter and have the owner then go to the animal shelter. It takes resources from the sheriff's office as well as costs the public.
do you have anything you want to add to that, Sheriff?
No, sir, that pretty much covers it. I just was here in case anybody had any questions for us.
Any questions or comments from board or staff? Is there any public comment? Seeing none, can I get a motion?
I'll make a motion to set a public hearing on Bill 2024-C, Ordinance 114, on May 15th, 2024.
Second it.
All those in favor, please say aye.
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 Aye, motion carries. Thank you, Sheriff.
Thank you.
Moving to appointment I, consideration and possible action, approval of the Churchill County Indigent Defense Plan for fiscal year 2024-2025.
Mr. Chairman, Jim Barbie, County Manager for the record. I'm presenting in lieu of Jacob Summers, who is unable to attend today. This is the plan that you approve yearly. It's had a couple adjustments to that. These adjustments were requested by the Department of Indigent Defense in putting this together. So those changes include basically under contracted labor for lawyers, that we identify the number of hours that the lawyers are working and/or the amount of FTE that the contracted attorney represents. It also asks that we ensure in the plan that the lawyers that we're contracting for are basically qualified to handle the level of cases that they're representing or handling through that process, which we have always done. So I'm not sure why that's a big deal for them, but clearly it is. And then lastly, that we include in the county's plan to comply with the new staffing regulations that you have already complied with through the budgetary process. So we are complying to the compliance of the complied. And that is the changes as submitted.
Thank you, State of Nevada. Any questions or comments from board or staff? Is there any public comment? Seeing none, can I get a motion?
I move to approve the Churchill County Indigent Defense Plan for FY 24-25.
Second.
It's been moved and seconded. All those in favor, please say aye.
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 Aye, motion carries. Appointment J, consideration and possible action, approval of the purchase of office furniture for the Office of Public Defender and alternate Public Defender in the amount of $80,579.98 to be paid to create spaces for furniture, equipment, move, and installation of all furniture items in the new Public Defender and alternate Public Defender offices.
Thank you, Mr. Chairman. Again, Jim Barbie for the record, submitting and presenting for Jacob Summers. Basically, this is the furniture that would be required to facilitate the staff and numbers of staff that will be required by DIDS in the Public Defender's office in the space that we refer to as the L building over off of North Main. The 80,000 represents basically 90% of the cost. That's the amount that will be reimbursed. We believe, based on the workload in the month, that this reimbursement request will be made. So in other words, They take the public defender's office, they identify that amount of work that is relative to indigent defense, which we believe is going to be around 90%. Then the county will pick up 10% of the furniture, and the reimbursement through DIDS will pick up the additional, what we believe will be $80,579.98. Thank you.
Any questions or comments from board or staff? Is there any public comment? Seeing none, can I get a motion?
I'll make a motion to approve payment of $80,579.98 to create spaces for new office furniture and for the move and installation of existing furniture items to the new public defender and alternate public defender's offices.
Second it.
All those in favor, please say aye.
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 Aye, motion carries. Appointment K, consideration and possible action, presentation by Winged Wolf Innovations on the Churchill County opioid assessment and recommendations for future outcome development. Shannon?
Good morning, Mr. Chair. For the record, I don't know. This one's not working, right? Oh. And for the record, Shannon Ertz, Churchill County Social Services. No, it just keeps blinking red and then green. So this morning I'm introducing Michelle Fullahauer. She is the principal for Winged Wolf Innovations. She also has Jordan Ernst with her, which they have been working tireless hours on our Churchill County opioid assessment and recommendations. As you know, we are required by the state to put this together, not only for Churchill County, but all of our other agencies. If any agency desires to proceed in applying for funds under the Resilient Nevada, they will have to refer to this plan and the recommendations in it. So today, Michelle will be presenting this. So you know the next steps with this is we will be meeting as a team here at Churchill County to develop what are our priorities for our funds, and be bringing that back to you in the future. So if you just keep that in mind. And Michelle.
Ha! Have to learn how to use the technology. Good morning. I am so excited to be here in front of you. As Shannon said, I am Michelle Fuller-Hellauer. I am the owner and CEO of Winged Wolf Innovations. Let me just give you a quick overview of who Winged Wolf Innovations is. Collectively, we have over 60 years of experience in social and human services fields. We specialize in systems change, facilitation, capacity building, program development, administration, and strategic planning. I personally have over 35 years working with populations that are vulnerable. I have worked with behavioral health folks that have HIV/AIDS, that are in workforce development, and folks that are with families and children, and the last 2 decades in homeless services. I've worked in direct service as well as management and systems redesign. We're committed to be a catalyst for transformative and innovative change and providing unique, customized solutions for the organizations and the communities that we serve. The purpose for the needs assessment that we did for your community was really to conduct, as Shannon stated, the opioids assessment to meet the needs for the state funds for Resilient Nevada. I'm not going to belabor the reasons because we really want to get into the meat of the assessment. And I know that we don't have a whole lot of time today, but I really want to identify, the overarching methodology. We really adhered to the Nevada Revised Statute to evaluate the local opioid crisis comprehensively. We used community-based participatory research and literature review. We developed a survey instrument and tailored that to your community's needs. We distributed flyers. We sent out reminders to key stakeholders. We did focus groups. We did one-on-one interviews, and we compiled all of that information, analyzed to identify trends, patterns, and differences, and then we utilized that information to generate actionable items to address the opioid crisis collaboratively. This slide really lays out the high-level sections in the report that I'm going to cover today. Now, I'm going to really quickly cover those high-level ideas, but I want to encourage you to read this riveting 223-page report. Don't worry, the meat and potatoes of the report's first 120 pages. But I really encourage you to read this report. Although I do suggest that you don't read it in bed unless you want it to cure your insomnia. So let's get into the details of what we found. The majority of your survey respondents for opioid use in Churchill County was prescribed by a physician for pain management. Opioid prescription rates in Churchill County have been decreasing since 2017, but they're still significant, as you can see with the blue line. They're down to about 1,000 a month, and methadone and buprenorphine, I could never say that word, prescription rates in Churchill County are relatively low compared to opioids. There's a zoomed in picture and separation of this chart in the report that where the methadone and buprenorphine rates that you can see at the bottom of this chart, where the methadone rates are reducing over time, they're down to about 30 per month, and the buprenorphine rates are up to about 70 per month. Your emergency department encounters and inpatient rates are shown on this chart. Unlike your emergency department visits, the inpatient rates are steadily increasing especially from 2016 through 2019, where it finally starts to drop. Worth noting here is that the data shows that those individuals who suffer from substance dependence have significantly higher rates of being admitted to the hospital rather than staying in the emergency department. White women have the highest rate of opioid dependence as seen at the Banner Churchill Community Hospital, and inpatient visits for opioid dependency in Churchill County have been decreasing. The Nevada Behavioral Health Region, which Churchill County falls in, has been seeing a decrease in emergency visits since 2016, as you can see, and the Nevada Behavioral Health Region has the highest rate of inpatient visits for opioid dependency in Nevada from 2015 to 2020. Throughout the report, we use the terms poisoning and overdoses interchangeably. Opioid poisonings have consistently been higher than other substances in both emergency rooms and inpatient visits. Men, particularly young white men, are more likely to suffer opioid poisoning in Churchill County. The northern region has a lower rate of inpatient visits for opioid poisoning in the state. Suspected drug overdoses in Churchill County exceed the state average, with fluctuations over time, as you can see. The number of overdoses encountered in Churchill County has been rising, with an increase in deaths in 2021 and 2022, as shown in more detail in the report. Again, I encourage you to read the report for more detail. There is a need for improved surveillance, particularly in reporting, identifying risk factors, increasing naloxone availability, and creating a suspected street overdose response team. Let's talk a little bit about deaths. Opioid-related deaths in Churchill County have remained relatively stable, but there is an anomalous spike in 2017. Opioids are the highest contributor to substance-related deaths in the Northern Behavioral Health Region. Law enforcement identified that there is a limited limited engagement regarding the opioid crisis, and it's primarily because they lack resources for extensive community education. They have made arrests for possessing and selling opioids. They have challenges in tracking certain data, such as opioid withdrawals in the jails and the number of respondents that have been obtaining high-dose prescriptions. They've reported that they've not been equipped with naloxone in the event of an opioid overdose, highlighting a potential gap in emergency response capabilities. They did provide some suggestions to prevent opioid misuse, including stricter enforcement and drug laws, enhanced collaboration with healthcare providers, increased community education, advocating for more laws requiring treatment center diversion, educating legislators on drug enforcement, or on drug effects for enacting harsher penalties, increasing law enforcement empathy through education, and providing specific training and resources.
Where are the training centers right now? I mean,
I'm sorry?
where are the locations for treatment
For treatment here in the community,
or outside the community?
you have one treatment center in the community outpatient treatment center, or, well, inpatient and outpatient, which is the name just escaped me.
Frontier.
Frontier, thank
Behavioral
you.
Health Center. And then there is several located within Reno and in Carson, but you do see wait lists to get into those for inpatient.
That's what I was getting at, is the wait list. And you want them in there immediately, but they have to wait.
If I may, sir, we'll talk about utilization in just a moment. There is a split opinion within the community regarding the critical nature of opioid use and misuse. Participants expressed feelings of humiliation, stigma, and fear associated with seeking treatment for opioid addiction. Challenges such as fear of job loss, financial instability, and fear of losing custody of their children were identified as barriers in seeking treatment. Childhood trauma, lack of activities, and familial influence are cited as causal factors for opioid use. 60% of survey respondents felt there weren't enough resources to address opioid use, while 20% were aware of available community resources. Suggestions for policy measures included increased funding for treatment programs, stricter prescription policies, harm reduction policies, and criminal justice reform. Community members advocated for bringing various stakeholders to the table, including military naval bases, hospitals, tribes, and local enforcement. Community members demonstrated moderate or strong collaboration, including sharing electronic health records, reporting or providing ongoing education, and implementing a team-based approach to patient care. However, challenges such as stigma and insufficient resources were identified as barriers to effective community support. Bureaucracy was identified as a barrier to addressing opioid use and misuse within Churchill County, potentially hindering the implementation of effective interventions. We do have some insights from folks that are previous users or current users of opioids. Stigma emerged as a primary barrier to seeking treatment, with participants expressing reluctance due to fear of judgment and societal perceptions. Other barriers included fear of job loss, financial instability, fear of losing custody of their children, and challenges with admission for treatment centers, which you identified. Factors such as the severity of withdrawal symptoms, lack of support, and challenges in resisting the urge to use during stressful times, and withdrawal symptoms that hindered individuals from seeking treatment sooner. 80% of current or previous opioid users weren't seeking help, citing reasons such as fear of withdrawal, society judgment, and lack of support. Opioid users felt misunderstood and unsupported by society, including family members, and fated challenges accessing treatment due to stigma and fear of consequences. Challenges in providing opioid treatment included limited availability of the medication-assisted treatment that from providers, stigma surrounding the medication-assisted treatment, or MAT, stringent regulations, and limited awareness of MAT effectiveness. Challenges in tailoring treatment plans include limited resources, logistical challenges in adjusting plans, and the complexity of addressing co-occurring conditions. Providers face challenges in maintaining patient engagement, geographic barriers, limiting access to services, and funding limitations for follow-up programs. While 50% of the respondents believed in the effectiveness of MAT, 50% were neutral about the effect. It seems important to note that none of the respondents indicated that they believed that MAT was ineffective. That suggests that the providers in Churchill County have generally seen a non-negative impact of use of MAT. So MAT would be, we suggest that MAT would be an effective use within Churchill County. Providers primarily found challenges in providing long-term follow-up and support due to engagement and geographic barriers, followed by limited resources, clients facing ongoing environmental stressors or targets or triggers, and stigma and discrimination. Providers address misconceptions by taking a patient-centered approach, collaborating with peers, engaging in open discussions, and utilizing education materials. Client focus groups unanimously agreed that opioid use results from mental illness and childhood trauma, with survey respondents supporting this notion, and that includes the providers. Respondents experienced negative consequences of opioid use, including a decline in overall mental and physical health, legal issues, and strained relationships. Opioid use affected work and academic performance, leading to challenges such as absenteeism and decreased productivity. Let's talk about utilization of our treatment programs. Churchill County has a utilization rate of 3.75% and treated more than 400 patients each year for mental health counseling. Now, this isn't opioid treatment, this is mental health treatment. So we just talked about mental health being co-occurring with opioid use. So the number of unique clients by state-funded mental health facilities in the northern region increased from 2011 to 2019. And based on the survey data, almost 92% of the respondents said that mental health support services and about 67% said accessible treatment centers were lacking in addressing opioid use and its consequences. So we know that there's a co-occurring issue happening here in Churchill County, but our mental health facilities aren't equipped to help deal with that co-occurring issue. This leads to the conclusion that an exploration needs to be made into why. Why is the utilization so low, and why are the mental health facilities not equipped to deal with opioid use along with mental illness? Let's shift our focus to our youth for a little bit. Data from the University of Reno, Nevada's Youth Risk Behavior Survey shows that from 2019 to 2021, our high school students have increased their belief that it's fairly or very easy to get prescription pain medicines. It's about 30%. It may not seem low, but that's high school. 30% of a high school students feel it's fairly easy or very easy to get pain medicines when they want. In that same time frame, you can see that high school students had a significant decrease in the feeling that it was great risk in taking medications that aren't theirs. That's a bit concerning. Now, let's look at something else, and I want to spend just a minute on this slide. The chart on the left illustrates the heroin use from 6th grade to 12th grade in 2019 and 2022. The chart on the right uses that same data, but it illustrates it by graduating class. When we look at that comparison, right, we can see that there's an increase in use from the students that are using something's happening between 8th and 9th grade, where there's an increase in use of heroin. We don't know exactly what's happening between 8th and 9th grade, but when looking at the percentage of students who have tried heroin for the class years, right, in comparison for classes 2019 through 2028, in the class of 2023 saw the most significant increase of 10% from 2019 to 2022. While the exact reason for that increase isn't known, it's worth contextualizing that the class of 2023 would have been in the 9th grade in 2020 when COVID started.
You're going to make this presentation to the school board?
Shannon Ertz, no, we're not going to the actual school board. We do have a meeting with the superintendent tomorrow to go over this and decide how he'd like to proceed.
Even though the subsequent graduating classes have a lower rate, you may want to keep an eye on this and consider implementing strategies to prevent another increase. I do want to point out that classes 2019 through 21 don't have data in the 2022 because they had already graduated. So let's talk about diversion. So Churchill County has implemented a drugs and sharps roundup programs to help prevent recreational drug use and unsafe disposal of sharps. Prescription drugs, drug drop boxes are available 24/7 for residents to dispose of unneeded drugs with plans for additional drop boxes in the future. The Sharps Exchange Program allows residents to exchange full Sharps containers for empty ones, reducing the risk for intravenous drug use in the community. New Frontier offers early intervention services for individuals at risk of developing substance use-related problems, including DUI education courses. So we recommend that those continue. Those are great programs. They are best practices, and we recommend that you absolutely continue those programs. We recommend that you implement clean exchange programs, safe injection sites, and harm reduction vending machines to further address drug use in the community. Focus groups are highly concerned Focus groups highlighted concerns regarding parents increasingly neglecting or ignoring signs of drug use among youth, contributing to the potential epidemic of opioid use. This lack of parental involvement and inconsistency in setting rules exacerbates family conflict, leading to youth taking on adult responsibilities prematurely. The Churchill Community Coalition has struggled to engage parents in educational programs with low voluntary participation, leading to the discontinuation of classes. The stigma associated with seeking help from mental health providers further hampers the efforts to address the parental concerns. Suggestions for addressing parental diversion includes launching outreach campaigns to raise awareness for youth drug use prevalence, promoting conversations between parents and children about opioid use, and offering resources for parents to support their children effectively. There are concerns about potential increases in child abuse resulting from negative parental reactions to substance use, highlight the need for conflict implementation and support for any interventions. Limited affordable community events and activities leave your youth with few alternatives to substance use, especially those who cannot afford sports or dance programs. Focus group recommendations include expanding programs like community centers and outdoor activities to provide safe, constructive alternatives. Concerns about students attending school under influence underscore the need for incentives promoting healthy behaviors and preventing substance use. Suggestions included incentivizing sobriety and cafeteria or school points for like a snack incentivization at school, or a school store, something to that effect, creating youth groups and mentoring programs, and expanding Medicaid coverage to include memberships in public facilities. We talked a bit more about that in the report. There is an example of that in Southern Nevada, where the MCOs are helping to pay for memberships at public facilities. We proposed initiatives also include developing in-school sober awareness clubs, offering scholarships for low-income students to access recreational activities, and providing additional counseling and support groups within schools to prevent substance use among youth. Overall, both parental and youth diversion tactics emphasize the importance of community engagement, education, and support to address the root causes of substance abuse and provide constructive alternatives for your youth. Drug court programs provide assessment, treatment, and referrals for court-assigned individuals. Services are based on restorative justice, Services are based on a restorative justice model and include incentives and sanctions. Motivation enhancement approaches are utilized to encourage behavior change. Activities are designed to benefit other people and promote positive behavior. Programs are phased with service intensity step-downs. Staff members model behaviors for clients. The number of patients at New Frontier Behavioral Health Center have increased for detoxification, residential, and outpatient services from 2021 to 2023. As you mentioned, Commissioner, the more folks are seeking services, and it's becoming harder to gain services for those limited beds. Different levels for outpatient services are available for adolescents and adults, including intensive outpatient and partial hospitalization. And recommendations include expanding and/or creating additional treatment options in the community. So let's talk about recommendations. So we aligned your recommendations with the state plan. So in order to try to make it easier for you and your community members and community agencies in applying for state funding. So as you read through our recommendations and the recommendations in the full report, when we talk about the goals and the strategies, they all are directly in alignment with the state plan. And the state plan is actually in the appendices of the report as well for easy reference. So goals 1 and 7 are here, refer to goal 1 and 7 of the state plan, and they are together under this slide because they both relate to data. So the recommendations These recommendations are intended the data collection from various sources related to substance use, and this includes schools, law enforcement, courts, and medical facilities. We recommend that you work to align the collection of data, and including detailed demographic and institutional data to inform the targeted interventions, in collaboration with the Nevada Division of Public and Behavioral Health, so that you can collect specific data related to opioid use and opioid deaths. Overall, the recommendations emphasize the importance of the comprehensive data collection, education, prevention, harm reduction, treatment access, and collaboration across agencies to address the opioid epidemic effectively here in Churchill County. For Goal 2, prevent and the misuse of opioids, the various objectives in this goal focus on educating the public, especially parents, on opioid prevention and treatment, breaking the stigma associated with substance use, and providing resources and support for families. Identifying risk factors for opioid misuse and overdose, including the distribution of drug testing equipment, public education on opioid prevention and treatment, targeting parents and breaking the stigma around substance use issues, educating parents and the public on recognizing adverse child experiences and preventing opioid misuse, coordination of family-related efforts across agencies to support youth and adolescents who have experienced adverse childhood experiences, implement and the broad use of prevention specialists, sober school programs, and awareness campaigns. For Goal 3, objectives aim to increase access to naloxone and fentanyl testing supplies, support safe harm reduction behaviors, and distribute clean needles and safe injection sites. We recommend that you increase the availability of naloxone and fentanyl testing supplies, and as I said, support safe harm reduction. Goal 4, provide behavioral health treatment. These objectives include expanding evidence-based programs in schools, increasing access to mental health counseling, expanding rehabilitation programs, and providing scholarships for those affected by the opioid epidemic. It also includes, increasing treatment options for everyone and increasing effective utilization of telehealth, including telemat services and a mobile MAP program. For Goal 6, provide opioid prevention and treatment consistently across criminal justice and public safety systems. Recommendations include expanding drug courts, utilizing medication-assisted treatment in the jails, and diverting individuals in treatment instead of incarceration. We would like to thank Shannon Ernst, the stakeholders, providers, and persons who are previously and currently using opioids, as well as your police department, sheriff's department, and your task force for completing surveys, participating in our focus groups, one-on-one meetings, and answering all of our follow-up questions. A special thank you to you all for listening to me today, for giving this report. And without your community's assistance, this report and the accompanying recommendations would not be possible. It has really been a pleasure to work in Churchill County, and I hope that we will have the opportunity and the honor of working with you again sometime in the future. Thank you very much. This ends my report, and I'm open for any questions and anything that I can do to help you.
Thank you for your report. Any questions or comments from board or staff?
Yeah, I have a question, if I can speak. You gave a very nice presentation. This was really good.
Thank you.
But I don't see how any of this is going to get implemented. I mean, I just don't see it. Shannon, can you help me with this?
Yes, sir. So Shannon Ernst, Churchill County Social Services. As you read these recommendations, this is not truly for Churchill County. This is for Churchill County and agencies that can be nonprofits, faith-based groups that can also participate in this. When we look at the big picture and the opioid use, we have many people playing within providing some part of treatment or some part of support. I will say the biggest issue we have in Churchill County is we don't have great data. As you see, there's so many numbers that are not just Churchill County because we are not collecting the data to know truly what is Churchill County. And so that is a place as Churchill County, I would like to see us change that within law enforcement, within our drug court programs, across the board. But what we would be doing is going back around table and looking at the recommendations and what can we do as Churchill County with the opioid settlement dollars we have. Then how can we support the community in getting them to apply for the Resilient Nevada funds that are available for the next 20 years by utilizing this report. There is a lot of things on there we are doing. We have naloxone. Social Services distributes naloxone daily. We provide it to law enforcement at their request. We provide the training and the certification to utilize naloxone and to distribute it to individuals that are in the community. I think there's a change in mindset as we look at it because of somebody that has overdosed. We need to use naloxone. We need to get them to treatment. And it may not be that they even knew that they took it. Fentanyl is a huge issue, as we know. You can pick up a dollar bill and you can attract fentanyl. So I think there is a lot we do. We're doing the Sharps containers. We provide the Sharps containers, and the coalition actually does it through their RX Roundup. And then we take them back and dispose of them through the lab, through the waste management. We can work with Central Nevada Health District to expand that and do more of that on a daily basis. So I think there is a lot of opportunity. I don't say that we're going to be able to do this all in this next year, but I think we do have a lot of opportunities. How do we develop better behavioral health and substance treatment systems and beds? That'll be a huge one, and it has been a conversation. A lot of individuals do not want to go to our local site because of the stigma. They don't want people to know. They feel like they're in the community. How do we change that? So a long, drawn-out, roundabout answer hopefully helped, and we'll be bringing more back.
Thank you.
Any other questions or comments? Seeing none, can I get a motion, please?
I move to approve the report as presented.
Second.
All those in favor, please say aye.
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 Aye. Motion carries. Thank you for your report again. Moving to consideration and possible action, this is L, ratification of a funding agreement between Churchill County Social Services and State of Nevada Health and Human Services, Division of Public and Behavioral Health, in the amount of $21,700 to support rural Nevada Continuum Care sponsorship. Shannon?
Again, for the record, Shannon Ernst, Churchill County Social Services. We had been applying for funds to support our sponsorship of the Rural Nevada Continuum Care and Wing Wolf's contract with the Rural Nevada Continuum Care. We act as a pass-through, but we are a huge member of the COC, and it is a requirement for us to maintain our HUD dollars. So we're very excited that DPBH came back with mental health funding to support the project in the $21,700, and so we're asking for ratification today.
Any questions or comments from board or staff? Is there any public comment? Seeing none, can I get a motion?
I'll make a motion to approve the ratification as presented.
Second it.
All those in favor, please say aye.
Aye.
Aye. Motion carries. Thank you, Shannon. Did anyone want to pull any of the letters received?
No.
Seeing none, we'll skip to 9A, consideration and possible action, affidavit of mailing delinquent tax notices from the Churchill County Clerk Treasurer pursuant to NRS 361-5.56483.
Pam Moore for the record. I didn't expect that Linda wasn't going to be here, and it just dawned on me I'm going to need to do this for her, so bear with me. So this is just something that's required by statutes that we handle each time. So this year, we sent out 717 first-year delinquency notices. 48 of those were returned. 12 of those were finally determined to be undeliverable. Second-year notices, we sent out 154. 24 were returned, and 5 deemed undeliverable. And third year, we had 85 mailed out, 28 returned, and 15 deemed undeliverable. So this is just our notification that the statutes require that we let you know that this has been done.
Thank you, Pam. Any questions or comments from board or staff? Any public comment? Can I get a motion, please?
I move to approve the affidavit of mailing delinquent tax notices and to note such in the minutes of the meeting.
Second.
It's been moved and seconded. All those in favor, please say aye.
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 Aye. Motion carries. New business B, consideration and possible action, approval to accept an invitation from the Bureau of Land Management to act as a cooperating agency in the National Environmental Policy Act, NEPA, review for the NV Energy proposed solar facility project in Churchill County, Nevada.
Mr. Chairman, Jim Barbie, County Manager, for the record. We are recommending that you move to accept the cooperating agency status with BLM relative to the Nevada Energy Project, and this is the same energy project that was presented earlier in the meeting.
Any questions or comments from board or staff? Is there any public comment? Seeing none, can I get a motion?
I'll make a motion to send a letter to accept invitation to act as a cooperating agency in this matter.
Second it.
It's been moved and seconded. All those in favor, please say aye.
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 Aye. Motion carries. Can I get a motion for the consent agenda? Consent agenda. Motion for it.
I move to approve the consent agenda.
Second.
All those in favor, please say aye.
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 Aye. Motion carries. Does anyone have any future agenda items they want to consider? Okay, seeing none, Commissioner and Management reports. Start with you, Justin.
I have nothing to pass at this time.
I have nothing either. Buzz?
I attended the Carson Water Subconservancy District meeting a week ago. Most of it is dealing with Douglas County and Carson. Very little with Churchill County. And that's all I have.
Sherry?
I have nothing, thank you.
Joe?
Nothing, thank you.
Jim?
Hugely successful CCJLS, a ton of scholarship money raised this past Saturday on behalf and representing Churchill County, so that was good stuff.
Pam?
For me, sorry.
Okay, claims and payroll are going around. Any public comment? Seeing none, we stand adjourned.